Welcome to the future.
Welcome to 1337, the Futura podcast of longevity. I'm Max, your host, and I explore the science of living longer.
And I'm Sophia, diving into health hacks and ageless living tips.
We're here to help you uncover the secrets to a vibrant, extended life.
You know how to live longer, and we're going to help you figure out how to make those years really count.
Exactly.
Yeah.
And today we're taking a deep dive into a topic that's often overlooked, but plays a huge role in our overall well-being.
You guessed it, sexual health.
We've got a great resource to guide us today. A YouTube video you shared featuring Dr. Rena Malik, a board-certified urologist.
From the Diary of a CEO, she's a real expert in the field.
She is, and she had so much valuable information to share. So for you, the learner, our mission today is to get beyond the basics.
We're going to debunk some common myths.
Uncover the facts and give you actionable insights to improve your sexual health and, in turn, your longevity.
And we promise to do it all without making you feel overwhelmed.
No lectures. Just a good conversation.
Sound good.
Perfect. Now let's jump right in.
Okay, so one of the first things that caught my attention in Dr. Malik's talk was the discussion around ejaculation frequency.
And prostate cancer risk.
Right. She cited a study that found men who ejaculate 21 or more times a month may have a lower risk of developing prostate cancer.
21 or more times a month, huh?
That number might seem a bit surprising, but it's the finding from this particular study.
So what's the thinking behind this possible link?
Well, Dr. Malik talked about something called the prostate stagnation hypothesis.
Prostate stagnation.
Yeah, essentially the idea is that the prostate gland produces fluids.
Right.
And frequent ejaculation helps to clear out and replenish those fluids, kind of like a natural flush.
Interesting. So it's almost like a regular maintenance routine for the prostate.
Exactly. And the theory suggests that this regular clearing might help prevent a buildup of substances.
Substances that could potentially contribute to cancer development.
Exactly.
Now, it's really important to emphasize this is just a correlation from one study.
Right. This doesn't mean causation.
It doesn't mean men should suddenly start aiming for a certain number of ejaculations per month.
No, definitely not. It's just one piece of the puzzle, and more research is definitely needed.
It's a starting point for further investigation.
Exactly. It highlights the potential biological mechanism that scientists can explore further.
Absolutely. Now, Dr. Malik also tackled some widespread myths about sexual activity, and one that I think resonates with a lot of people.
Is the feeling that everyone else is having way more sex than they are?
You see it all the time in movies and TV shows.
This idea that everyone's having this super frequent, amazing sex life.
And it can create a lot of pressure and insecurity.
Right. It's like this unspoken competition, but Dr. Malik shared some data that might put things into perspective.
Oh, yeah. What was that?
Well, she said that the average frequency of sex in partnered relationships is actually about once a week.
Once a week.
That's right. So if you're feeling like you're not measuring up, chances are you're probably right on track.
That's actually really reassuring to hear.
Right. It takes the pressure off. And even more importantly, Dr. Malik emphasized that the quality of sexual encounters is far more important than the quantity.
Makes sense. It's about connection and mutual pleasure, not just how often you do it.
Exactly. A fulfilling experience, even if it's not super frequent, is much more beneficial than rushed or unsatisfying sex.
Absolutely. Now, another myth she addressed that's especially important for women is the idea that sex is supposed to be painful.
Oh, yeah, that's a harmful one.
It can lead to a lot of unnecessary suffering.
Dr. Malik made it clear that pain during sex is not normal.
And it's important to seek help if you're experiencing it.
Exactly. She highlighted some common reasons why pain might occur, particularly for women.
Like what?
Well, insufficient lubrication is a big one.
Makes sense.
And also inadequate foreplay.
Right. It takes time for the body to prepare for intercourse.
And that's where things get really fascinating.
Oh, yeah.
Dr. Malik explained that the vagina actually undergoes a remarkable physical transformation during arousal. Yeah, it expands in both length and width, almost doubling in size.
Wow, that's incredible. I had no idea.
It's amazing, right? And this process takes about 18 to 20 minutes on average.
18 to 20 minutes.
Which is why adequate foreplay is so crucial.
So rushing into intercourse before the body is fully aroused can lead to discomfort and pain.
Exactly. It's about giving the body the time it needs to respond and prepare.
And if pain persists, it's essential to see a healthcare professional.
Absolutely. There could be underlying medical conditions that need to be addressed.
So we've talked about some of the myths Dr. Malik debunked.
Yeah.
Did she address any other ones that come to mind?
Oh, there were a few more classic ones she tackled. Like the idea that masturbation can cause blindness.
Oh, right, that old chestnut.
Yeah, totally unfounded, no scientific basis whatsoever.
Good to know. What about that other one, the supposed link between penis size and hand or foot size?
That one, too, went straight into the myth-busting bin.
I always thought that one was a bit far-fetched.
She even mentioned a Japanese study that found a correlation between nose length and penile length.
Nose length.
Yeah, in Japanese men specifically, but even that's likely just a coincidence.
So no need to start comparing noses then?
Nope. And finally, Dr. Malik also clarified that a woman's vagina does not get permanently larger from having more sex.
That's a concern I've heard before.
It is, but it's not true.
So put that worry to rest.
Exactly. She explained that a feeling of looseness sometimes occurs due to weakening of the pelvic floor muscles.
Which can happen after childbirth or as we age.
Right, but it's not directly caused by how much sex a woman has.
Good to have that cleared up.
Absolutely. Now, beyond debunking these myths, Dr. Malik also provided a really helpful definition of what sexual health actually encompasses.
It's clearly about more than just the absence of disease.
Right. She defined it as being able to have sex,
Experience orgasm,
and derive pleasure from it.
and all the benefits that come with it.
Like stress reduction.
Better sleep.
It's about feeling good in your body and in your relationships.
So it's about overall well-being.
Exactly. And she pointed out a major obstacle to achieving this for many people: the lack of comprehensive sexual health education.
And open conversations about sex.
It's a topic that's often shrouded in silence and stigma.
And that can leave people feeling uninformed and ashamed.
Dr. Malik's goal is to change that.
She wants to make accurate and accessible sexual health education available to everyone.
So people can feel empowered to take control of their sexual well-being.
I think that's so important.
Now, shifting gears a bit, let's talk about something Dr. Malik emphasized: the pelvic floor.
For a lot of people, that might seem like a bit of a mystery.
Right? They might have heard of it.
But not really understand what it is or why it matters.
So let's break it down.
Okay, so first things first, what exactly is the pelvic floor?
Dr. Malik described it as a bowl of muscles that sits at the base of your pelvis.
A bowl of muscles.
Yeah, it kind of acts like a hammock supporting your pelvic organs.
I see. And what does it do exactly?
Well, it's involved in a whole bunch of important functions.
Like what?
Well, for starters, it helps to control your bladder and bowels.
So it prevents leaks and accidents?
Exactly. It also provides support during pregnancy for women.
And here's the part that might surprise some people.
It plays a crucial role in sexual function for both men and women.
Both men and women.
Yes. Men have a pelvic floor, too.
So it's not just a women's health issue.
Not at all. And just like in women, both a weak and an overly tense pelvic floor can cause problems in men.
So what kind of issues can arise from a weak pelvic floor?
Well, for both men and women, it can lead to urinary incontinence.
Leaking urine.
Yes, or fecal incontinence.
Which is leaking stool,
Right. It can also contribute to prolapse.
where the pelvic organs start to drop down.
Exactly. Now, what about a tense pelvic floor? What issues can that cause?
Yeah, what happens when those muscles are too tight?
Well, it can lead to pain during sex.
For both men and women.
Yes, and it can also contribute to constipation.
Because the muscles involved in bowel movements are too tense.
Right, and for men, it can even lead to erectile dysfunction.
Wow, so the pelvic floor is really involved in a lot of important functions.
It is. And Dr. Malik mentioned something that I think is really relevant to our modern lifestyles.
What's that?
She said that prolonged sitting can actually contribute to pelvic floor dysfunction.
Because we're not using those muscles properly.
Exactly. We're sitting for hours on end.
Which can lead to chronic tension in the pelvic floor.
And that can have all sorts of knock-on effects.
So what can we do about it?
Well, Dr. Malik recommended pelvic floor exercises.
Often called Kegels.
Yes. Kegels involve consciously contracting and relaxing the pelvic floor muscles.
And she stressed the importance of doing them correctly.
You want to make sure you're engaging the right muscles.
And not just squeezing everything.
Right. And she also emphasized the need for relaxation.
Not just constant contraction.
Exactly. It's about finding that balance between strength and flexibility.
Like with any other muscle group.
Now, here's a fun fact.
Oh, I love fun facts.
Dr. Malik mentioned that orgasm itself is an involuntary pelvic floor exercise.
So there's another benefit to a healthy sex life.
Exactly.
Now let's move on to another fascinating aspect of sexual health.
Sexual desire.
It's a complex topic.
It's a lot of individual variation.
And Dr. Malik explained that there are actually two types of desire. Spontaneous and responsive.
Can you break those down for us?
Sure. Spontaneous desire is that out-of-the-blue feeling of wanting sex.
Like you see someone attractive and boom!
Or you have a sexy thought and suddenly you're in the mood.
Whereas responsive desire develops in response to stimulation.
So you might not be thinking about sex initially.
But as you start kissing or touching...
the desire starts to build.
Interesting.
And is one type of desire more common than the other?
Well, Dr. Malik said that men tend to experience spontaneous desire more often.
And women in long-term relationships often experience more responsive desire.
It's not that one is better than the other.
It's just a difference in how desire can manifest.
And understanding this can help couples communicate better.
Avoid misunderstandings and frustration.
Absolutely. Now, she also talked about the role of testosterone in libido.
And I think a lot of people associate testosterone with men.
Right. But it's important for women's sexual desire, too.
Even though women have much lower levels of testosterone.
It still plays a key role in their libido.
Interesting. So what are some of the factors that can impact testosterone levels?
Well, Dr. Malik highlighted a few important ones.
Let's hear them.
Sleep is a big one. Lack of sleep can really tank your testosterone.
So getting enough rest is crucial.
Absolutely. Exercise is another factor.
Now, I know exercise is generally good for you.
It is, but there are some nuances when it comes to testosterone.
Oh, like what?
Well, resistance training, like weightlifting, tends to boost testosterone
But excessive endurance training can sometimes lower it.
because it puts a lot of stress on the body.
So it's about finding that sweet spot
Right. And speaking of stress, chronic stress is another testosterone killer,
because it raises cortisol levels.
which can then suppress testosterone production.
So managing stress is important for hormonal balance.
Absolutely. And finally, diet plays a role too.
Okay, what should we be eating?
Well, healthy fats are important because your body needs cholesterol to produce testosterone.
So those extremely low-fat diets might not be the best for hormone health.
That's right. Now, Dr. Malik also touched on a concerning trend that's been observed in recent decades.
What's that?
A decline in average testosterone levels and sperm quality in men.
That's definitely worrying.
It is, and there are likely multiple factors at play.
Like what?
Well, sedentary lifestyles are definitely a contributor,
We're not moving enough.
and metabolic conditions like type 2 diabetes are also on the rise.
And those can impact hormone production.
Exactly. And then there's the growing concern about environmental endocrine disruptors.
Those are chemicals that can interfere with our hormones.
Right. And some of these chemicals are found in plastics.
So all the more reason to reduce our plastic use.
Absolutely. Dr. Malik suggested simple steps like avoiding single-use plastic water bottles.
And using glass containers for food storage and heating.
It's about making those small changes that can have a big impact on our health.
Now, speaking of male sexual health, Dr. Malik also addressed the topic of semen volume.
Something that some men might be curious about.
So what influences semen volume?
Well, the biggest factor is actually how long it's been since the last ejaculation.
So the longer the time between ejaculations, the larger the volume.
Exactly. Hydration also plays a role.
So drinking enough water is important.
Always. And she also mentioned that what might seem like a decrease in semen volume with age,
Could actually be due to a decrease in the force of ejaculation.
which, as we talked about earlier, can be improved by strengthening the pelvic floor muscles.
So those Kegel exercises are good for men too.
Absolutely. Now let's talk about technology.
It's become such a huge part of our lives.
And Dr. Malik discussed the potential impact of technology on sexual health.
Specifically the habit of keeping phones and laptops near our genitals.
Right, because the heat from those devices can actually negatively affect sperm production.
So guys, maybe think twice about keeping your phone in your front pocket.
It's a simple change that could make the difference.
Now, Dr. Malik also touched on a really important but often sensitive topic. Trauma,
Trauma can have profound effects on our physical and emotional health.
including our sexual health.
And she emphasized the importance of seeking professional help if you've experienced trauma.
Whether it's physical, emotional, or sexual trauma,
It can have long-lasting effects on the body.
including the pelvic floor.
Trauma can lead to chronic muscle tension
Pain.
and difficulty relaxing.
And she also acknowledged the psychological components of sexual dysfunction.
The mind and body are interconnected.
And our emotional well-being plays a huge role in our sexual health.
Now let's talk about sex during pregnancy.
I think there are still a lot of misconceptions out there.
People might worry that it could be harmful.
But Dr. Malik was very clear on this point.
She said that it is generally safe to have sex throughout pregnancy.
In the absence of any specific medical complications,
Right. So unless your doctor has advised otherwise, you can continue to enjoy intimacy with your partner.
That's good to know. Now let's delve into female sexual response.
Specifically, the clitoris and female orgasm.
And Dr. Malik pointed out that historically there's been a lot more research on male sexuality.
Oh, female sexuality.
Which has led to some gaps in our understanding.
She really emphasized the importance of understanding the clitoris.
And its role in female pleasure.
She explained that it's actually developmentally similar to the penis.
Both originating from the same embryonic tissue.
And the clitoris extends much deeper into the pelvis than just the visible part.
So it's a much more complex organ than many people realize.
Exactly. And she highlighted that clitoral stimulation is the most reliable way for women to achieve orgasm.
About 85% of women need clitoral stimulation to reach climax.
Which is why vaginal penetration alone is often not enough.
That makes sense.
And she pointed out that the average time to orgasm for men and women during intercourse can differ significantly.
With men typically reaching orgasm faster,
which can lead to a disconnect if the focus is solely on male pleasure.
So communication and understanding are key.
Absolutely. Now, based on Dr. Malik's expertise, what are some practical tips for enhancing female pleasure?
Well, she really stressed the importance of open and honest communication between partners.
Talk about what you like.
What you don't like.
What feels good.
Don't be afraid to express your needs and desires.
She also recommended incorporating direct clitoral stimulation.
And using lubricant to enhance comfort and pleasure.
And here's an interesting suggestion she made.
What's that?
Scheduling time for intimacy.
Not necessarily sex, but just dedicated time for physical connection.
It can help take the pressure off.
And allow for more relaxed exploration.
She also mentioned the benefits of mindfulness during sexual activity.
Paying attention to the sensations in your body.
And being present in the moment.
Now, Dr. Malik also cautioned against comparing our sex lives to what we see in the media.
Especially pornography.
It often presents unrealistic portrayals.
Which can lead to unrealistic expectations and anxieties.
It's important to remember that real life is different.
And that's okay.
Now let's revisit the topic of penis size.
It's a common source of anxiety for men.
And Dr. Malik shared some data that might help put things in perspective.
She said that many people overestimate the average erect penis size.
Thinking it's around 6 inches.
When in reality, the average is closer to 5.1 to 5.3 inches.
And research on women's preferences in sex toys
suggests that they tend to prefer sizes within this average range.
So size is really not as important as many men think.
And clitoral stimulation being the primary driver of female orgasm for most women.
Further diminishes the importance of penis size for their pleasure.
Exactly. Now, what about changes in penis size with age?
Is shrinkage a natural part of aging?
Not typically in a healthy individual.
But certain medical conditions that affect blood flow,
like high blood pressure, diabetes, and heart disease,
can lead to tissue changes and potentially some shortening over time.
And weight gain can also make the penis appear shorter.
Due to fat accumulation in the pubic area.
So maintaining a healthy weight is important for various reasons.
Now, Dr. Malik also discussed the labia.
And the growing interest in labiaplasty.
It's cosmetic surgery to reduce the size of the labia.
And Dr. Malik emphasized that there's a wide range of normal variation in labial appearance.
So, what we see in pornography is not necessarily representative of what's normal.
And labiaplasty is a personal decision.
But it's important to understand the risks and benefits.
And to make sure you're doing it for the right reasons.
Now finally, let's talk about female ejaculation or squirting.
It's a topic that's often misunderstood.
And the science is still evolving.
Dr. Malik differentiated between lubrication,
which is normal vaginal wetness.
Female ejaculation,
which is a small amount of fluid produced by the Skene's glands.
And squirting,
which is a more substantial release of clear fluid from the urethra.
The composition of squirting fluid is still being debated.
Some studies suggest it might be dilute urine.
But many women who experience squirting say it feels distinct from urination.
So more research is needed to fully understand this phenomenon.
But ultimately, Dr. Malik's message was that it shouldn't be the primary focus or goal during sexual activity.
What an incredible deep dive into the world of sexual health.
We've covered so much ground.
From debunking myths to understanding the pelvic floor.
To exploring the nuances of sexual desire and response.
You, the learner, now have a wealth of knowledge to empower you on your journey to a longer, healthier, and more fulfilling life.
We hope this conversation has given you some aha moments.
And inspired you to prioritize your sexual well-being.
Remember, open communication and a focus on overall health are key.
And if you're experiencing any issues, don't hesitate to seek professional help.
It's a sign of strength, not weakness.
Absolutely. So how can you take what you've learned today
And apply it to your own life.
What steps can you take to improve your understanding and communication around sexual health?
We encourage you to reflect on that.
And to continue exploring this important aspect of your well-being.
For more resources and discussions on longevity and well-being,
visit us at 1337podcast.com.
Thank you for joining us for this deep dive.
We'll see you next time.
Strength and honor.
I am Spartacus.
Thanks for watching. Tap into 1337podcast.com.